Guys, and welcome back to my YouTube channel. I'm Simi and I'll be bringing you content on faith, nursing, and life. So stay tuned, okay? Stay tuned for all the content I'm going to be bringing your way on this channel. Video is going to be about being a neuro nurse. I actually googled. I went on YouTube, searched for neuro nurse content and all that good stuff, and all I was seeing was all these old content, like basically old content, like from other nurses, and it's been a while, and I want to be that new breath of fresh air basically into like new nurses that are actually in neuro-ICU, because when you search up neuro-ICU you only see ICU nurses, like ICU content basically, but I'm here to give you content on neuro-ICU. So what is it like being or working as a neuro-ICU nurse? First off, we're going to talk about what a neuro-ICU nurse is, or who is a neuro-ICU nurse. A neuro-ICU nurse is basically a nurse who takes care of neuro patients. Neuro patients like stroke, like MS, that's multiple sclerosis, like myasthenia gravis, like what else? Spinal cord issues, anything that deals with the brain, any problem that's like happened to the brain, any traumatic brain injury, any head injury, anything like that, any confused patient basically comes to our unit to get care. The care of these patients are slightly different from med-surg patients, because we treat a lot of stroke patients a lot because they're somehow not able to do things themselves like they would, because their brain has gotten injured or their brain was injured and they can't do some functions like what a person that didn't have any brain injury would do. So there are different types of strokes. I'm not going into any of that, but some of them are not able to use their hand, their feet, their legs, like one side of their body, as well as they would before they had the stroke. And so we have to be there to help them. Some people that suffer from encephalopathy, I don't know, that word always trips me up. I don't know if I even pronounced it well, but I'll put it on the screen so you know what I'm saying. They are confused patients. So basically, we give them a medication called lactulose to like flush all the confusion out, basically by having bowel movements. And so like that could be disastrous if you're giving that on your shift, and you just be expecting that they're gonna have bowel movements. And most of these people are people that cannot actually clean themselves or do anything themselves because they're confused. So you have to keep on going there to clean them, to wipe them, all that good stuff, to make sure that they're comfortable. And even though they might not know what's going on, you just want to be there for your patients irrespective. Another issue we suffer from a lot is injuries, like falls. So we like preventing falls on our unit because we always have falls, because these patients aren't the strongest. So when they get up to their feet, it could be wobbly. So we always have bed alarms on, so that if anything happens when they want to try get up because they're confused, or even if they're not confused, some patients want to do things themselves, and I totally get that, because before they came to the hospital they were able to do these things themselves. Like they didn't call anybody before they wanted they didn't have to call anyone before they had to go use the loo. So they would basically trigger the bed alarm trying to get up, and then we run into there. We run there and like find them trying to get up, and we have to like get them back into the bed safely. Some patients fight you, some patients really do attack you, and I've gotten slapped by a patient before, and this patient was confused. I was like, oh wow. This patient had long nails too. Not long nails, but I felt it. So it was like, oh my God knows. I had to go, like, I don't know. So your mental health gets a hit too, because some patients are violent, and some patients would talk back to you. There was this patient that didn't have that had a BKA, basically bilateral knee amputation, and was violent. But thank God I mean, thank I wouldn't say thank God, but thank God he couldn't attack, So there's so many pros and cons to this job, and I would start by saying, going over the number one pro is for my hospital, you can set your schedule. Like you can pick the days you want to work. They get approved mostly, but sometimes if they're short staffed on a certain day, they can put you there, you get. But you know your schedule every 6 weeks, and that's a pro for me because then I can figure out what I want to do, what days I don't want to work, and how I want to basically work my schedule. Like, is it 3 days off, 4 days on, a week off, or 3 days, all of that good stuff. But I've noticed that actually that 3 days in a row doesn't work for me as much, and I'm trying to like give myself breaks in between so that it's not too much on me because there've been days, man, that I don't want to go to work. Trust me. Another pro of working on my unit as a neuro nurse is that I'm trying to think about a pro right now, like patients that are aware, and patients in general could be really nice and sweet and grateful for the care that you've provided them. That's another pro of working in this nursing profession. That's a pro. If you ask me, like some patients really do show gratitude and really do show how grateful they are to you, and I could not be more grateful to take care of them when they are at their worst moments. I like that they would need my services and I can provide the them. Third pro I would say is that Neuro-ICU nurses help each other. Like, because we know how difficult the work can be, we are always there to help each other. We're always there to lift each other up. Especially in my unit, I work as a night shift nurse, so we help each other. We're always there for each other, and I'm grateful for that community. Even though we're short staffed on many nights, we're still there for each other. We show up and show off for each other. That's amazing. If you don't have that, then that's a big problem, especially working as a neuro ICU nurse, because sometimes you're not where your patients are like at that moment, and the bed alarm is going off and you have to be in there to help them back into bed. Who will help them? Obviously your colleagues have to help you, right? And so like that's a big pro. You have to have people there for you. Fourth thing I like to talk about as a pro of working on a neuro ICU floor is basically you get to use your nursing skills, like all the skills they taught you in nursing school. You get to use a bit here and there and here and there. It's not a real med surg unit. It we do have COVID, so you get to use almost everything. So it's a good place to start off as well. Like if you're considering not going to med surg, but you want something different, neuro ICU floor is a good floor. If you like a stroke floor, basically is good as well. But you get to use all like most of your skills as a because most of these people also have pressure ulcers because they're not able to move, turn, all that good stuff by themselves. So you have to help them. You see different cases, you see different things, you see different medications, not as much. There's some medications that you get accustomed to, like blood pressure medications for, especially for stroke people, because when they come in, their blood pressure is crazy high. But we let them be crazy high. Like you get to use your critical thinking because they just had a stroke. You don't want to bring it down because their brain won't get as much perfusion. So you want that to be like it's permissive hypertension. That's what we call it for the first 24 hours. We do treat if it goes above a certain number, like 220 over something. That's crazy high. They don't teach you that in like maybe they do, but yeah. I mean, most of the things I've learned was during my orientation and during my stay on this hospital in this hospital. So yeah. So let's go to the cons. The con basically number one is these patients are confused. You're gonna have many bad nights. But what keeps me going basically what a lot of things have been keeping me going. Definitely not coffee because coffee is not good for me. But the thing is, one con basically is that, yeah, confused patients. So these patients will give you the run. They will give you the run for your money. You're working. You're basically working every dollar. Trust me, no dollar is going to waste on this. Con is that you're always short staffed. Most nights you're short staffed, and That's not a good thing. I feel like that's a general problem with all hospitals. But hey, we should do better, because when we're staffed right, it's safe. It creates a safe environment for not only us, the nurses, but also our patients. And I feel like people don't think about that enough. Like, if you want your satisfaction, your patient satisfaction rate to go up, then you have to staff us right so we can do our jobs appropriately, efficiently. You can't bombard us with five patients, and these patients are full care, like a lot of care, and expect us to do our work as 100% efficient all the time. It's not gonna work. Another kind of working on this neuro ICU floor is basically you deal with a lot of patients that could go from 0 to 100 real quick. They could be all right now, and then boom, they're having another stroke, or boom, their blood pressure is skyrocketing, and you're scared to bring it out too fast. Boom, faced with a patient that is violent or very confused and wants to fight everyone in the room. There's so many cons basically, and I feel like my one thing is that I would like to work in this unit for at least a year and then go into something else. But I do like neurology. Like, I feel like the reason why I like neurology so much is because I was failing in nursing school in my last semester, and I had to really study this neurology aspect to really get things right. Okay, I really had to study it, because that was the exam that would have helped my grades so much, and I did pass that exam. Like, I got 93% on that exam, and I know it's enough. Like, I know a lot of things about it. I'm still learning. There's still some things that people might expect me to know that I don't know at the moment, but hey, it is what it is, and I'm going to keep learning. I hope you did enjoy this video. If you did, give me a thumbs up. If you didn't, just give me some, tips, on how to improve. I'm doing this because I would like you to see more content, and if you don't like it, then that's a problem. I would like you to like it. So please do click that subscribe button and turn on your post notifications so that you know when I release more videos for you, of course. Remember, I am Sumi, and I'll be back, okay? Thank you so much for watching this video. Peace. If you haven't watched any of my other videos, go watch them. I'm gonna be putting them on the screen somewhere here. More content, because I know that going forward I'll be releasing more videos on nursing. Tell me what you would like to see. Just comment below what you'd like to see on this channel, and I will try my best to bring it to you. Thank you.